to the next, because the doctor before does not want to repeat ultrasounds. They don't want to repeat, all those tests, the blood work that you did. So you want to always have your medical records, especially if you're going to be moving to a different doctor. If you do plan to just walk into an emergency room, definitely have your medical records, because sometimes they don't want to, like, they're legally bound by New York state law to take you, but they want your medical records. They will not do anything with you. They will admit you, but they will probably not do much with you without medical records. So you want to get that stuff.
So I think it's important to note that it's not a level of being physically comfortable, but mentally comfortable with, and in the space, being comfortable with the people around you, knowing that they know what you're looking for and what you've discussed over a number of months. And also, you mentioned being the trust word. So being able to trust that person, that if anything happens, they know what to do and who to go to. If you're going into ER, it's just like, yeah, let me read through your papers. Okay, right. Great. Here's a stamp, or here's a sticker. You did good. It's like a substitute teacher and a teacher, right? Your teacher knows you over time. Stop goofing around. Stop slacking off. I know you could do better. And the sub is like, well, this is what you gave. Okay, great. Here's a check mark. I'll let your teacher know tomorrow that you did a good job. So that's how I kind of see it.
Right. And I was to think with that question, I would assume if you're going to the ER, like it's like clearly an emergency, and it would be, it's best to, to have your medical records, because they wouldn't have everything. And in an emergency situation, they're trying to save your life. So they may not have time to really look at everything. So it's better to have that continuity of care, and going to, even if you go into an emergency room, going to the hospital where your provider is, is affiliated.
Yeah. Right. And if it's not a case of labor, and you're just going to the emergency room, by all means, definitely go to the ER, but call your doctor and let them know.
And someone put in the chat, pre-pregnancy planning is so important. I didn't know my GYN doesn't do VBAC until I was put in the situation. And that's very important to note, which is why we're having this discussion right now, especially when we first started talking about the questions that you need to ask your provider, so that you're making, or you have the right person for you in the event that you have any scenario for your pregnancy. So that's all important.
So I just wanted to clarify for those who may not know, VBAC means vaginal birth after cesarean. So if you have had a C-section, as long as it wasn't done classical, straight down, if you had a C-section where they did it like in the bikini area, you can deliver naturally, vaginally afterwards. And so, that's an important question to have when you're with your provider.
We have another question in the chat by Tracy Ann. It seems like doctors towards the Black community rush to do C-sections with many issues. What are good reasons to have a C-section when you want to have a natural birth?
Good reasons? Life or death situation. If the cesarean, if your plan is to have a vaginal birth, a natural birth, and so there's complications, and in that, and the doctors are saying, something's wrong with the baby's heart rate, or the patient, the mother is having complications as well, then they would move to having a cesarean section to get the baby out, and to try to make sure you both are alive. But there, also we have what's called designer births, where women plan, to go in and have a C-section on a day, and they may also get like a tummy tuck at the same time, just to make sure everything is good and ready. And Thamar, you could take this as far as a good reason.
I like that term. Yes, I've met some very privileged people that do that. But so yes, there are good reasons to have C-sections. Not to get too clinical, because again, I'm not a clinical provider and I don't know exactly a lot of things. But you said if it's a matter of life and death. As Black women, we have to be careful with that, because I find in my line of work that doctors use that line when they want to hurry up and they are tired and they want to coerce you into doing something so they could get out of there. So I don't know why it's not coming to my head, but like one reason why you would want a C-section is you the baby's heart rate is dropping, it's decelerating, and there's some you could talk to your doctor about this and get the clinical the clinical answers, but like if it has to happen over like and you could correct me if I'm wrong, Nerline, but like it has to be like over like 20 minutes, and the baby's heart rate is definitely decelerating every time there's a contraction or something like that, and it has to happen a certain amount of times, and then they have to move quickly to get you a C-section, or if there's something like the cord wrapped around the baby's neck, or like. And I also feel like, going back to just knowing when something is wrong, when there's something wrong, and trust me. And, people look at doulas and say, oh, I want a natural. I'm not here to give you a natural birth. I'm here to make sure that you're good. I'm here to support you in whatever decisions happen, whatever happens, like I'm here to be with you. I've helped moms that have had planned C-sections. I've supported moms that have had to have emergency C-sections, and it's never a joke. Like if I'm there, if you're getting the C-section, it's because you need that C-section. Or, I've met moms that were in hard labor for 36 hours that ended up getting a C-section, and it's not necessarily something was wrong. They were literally, figuratively, mentally, emotionally tired, exhausted, and they decided to have a C-section. But that question is really loaded, and that's something that you want to sit down with your doctor to talk about. So like high blood pressure, if there's a chance of preeclampsia, like those are all reasons. Or like there's a chance that the baby might have shoulder dystocia, like and that's, sorry for throwing out terms like that, but like that's when like the baby's shoulder gets stuck and they can't get it out. So they can they would probably want to do a C-section before that happens. So there's definitely reasons, but again, sit down with your doctor and go over it and get specific answers if that's something you don't want, if it's not absolutely necessary.
Yeah. And when you have that conversation with your doctor, so so when if that scenario is presented to you, if your doctor says, hey, we're at that point, and I think this is what we need to do, you already had that conversation, you already prepared yourself, and accepted, like, what, this is okay, now this is where it's headed, so you're better prepared for it.
So we have a few more questions in the chat, but that was I think that was like a fire round. That was really good. There's a question, Janelle, she says, how do you get the medical record without a runaround? I kind of want to answer that. Ask for it before you leave the office. That's something I've been doing.
That's what I did.
The past few months. Get the printout. If they have a lot of these places right now due to COVID are doing like electronic charts, and they'll give you like a log on, so you could get like a My Chart or something like that. You can log on and see all the test results, the doctor's notes, and all that stuff. So before you leave the appointment or wherever you had appointment before, ask for those notes, the visit notes or test results. Get them printed or faxed to you, emailed to you, whatever, and keep a record for yourself. Because it's going to be easy for you to navigate, especially if you're switching providers, for you to have that history that's already written down. But if you guys want to add to that.
No, that's not that you said that. I mean, I actually do that with regular appointments, with my kids' appointments. Right now. Oh, wait, I wanted to shout out to my husband who's with the kids right now so that I could be here. I do that now with every appointment. I ask for the doctor for the visit for mine as well. Yeah. Get in the habit of doing it, getting the progress notes of the record from that visit. Or if when you go in from the last visit, like if it's not ready, and just so you have the records.
Okay. Yeah, I was gonna say sometimes it's not that easy. I don't know where your question is stemming from, but I know like working within the HHC system, sometimes it's a little hard to get your medical records, especially in the bigger institutions, because you have to like go to the medical records department and things like that. If your reason for getting your medical records is to go to a different provider, have the provider send the stuff in. That's one way. Or you would have to go to your if it's like a really big hospital, going to the medical, and they don't have an electronic system to share with patients yet. Go to the medical records department and fill it out. Ask for where it is. Go to it, because it might take a few days, it might whatever, but just make sure that you are clear on where it's going. If it's going to a different medical providers usually have their medical record release sheets, like have that and fill it out and have them sign it. And you sign it and have them send it directly to that new medical provider if you want a copy or whatever. It's just different hospitals have different rules. So, it is what it is.
So I want to talk about a few other things. We have some questions in the chat, but I just want to give some context to some key topics that I think are really important before we get to those questions. So this is like, just real general and in no particular order, but do you suggest parents take a childbirth education class, and how important is it? And should it be a part of, your pre-planning? Why are you laughing? I can't hear you. I'm sorry.
Oh, I said because I want to answer it.
Oh, okay. And should it be a part of, your overall like pre-planning stage, or can you do this down the line? So that was like 3 questions in one. I hope you got all of that.
I got all of it. Don't worry.
Okay, good.
Childbirth education, take it. Yes, please take a childbirth education class. There's not many now, but I feel like take a childbirth education class that is taught by a Black person. Take a childbirth education class. You said when? I honestly wouldn't take if it's like a classic childbirthing education class, I wouldn't take it so early in my pregnancy. I would save it for like the 2nd, 3rd trimester. Because it is a lot of information. And to be honest, you probably will forget most of it. So you want to take it as close to labor as possible, because y'all, there's so much information that people don't know. And as a doula, me and my partner, we haven't made it a requirement yet, but we're like this close. If you do not take a childbirth education class, we don't want to work with you.
Really?
Yeah, it's getting to that point, because there's so much that you should know, and that is so helpful. And as a doula, if you're not going to pay me for that, like, it's so much work for me to try to teach you like 12 hours worth of information in a couple of sessions that we have together. That's not my focus. If you're hiring me just to be your doula, if you're hiring me to be your childbirth educator, sure, I'll add the 12 hours, but it's so much valuable information, from pain management to like just understanding your physiologically what's going on in your body during labor, talking about immediate postpartum and what that looks like. And tied to a lot of childbirth education courses are breastfeeding. And sometimes they add, what's that life-saving thing?
Oh, basically CPR.
Yes, CPR, like child CPR, breastfeeding, and child care, like it's not neonatal care, is it? So like all of those things are a part of it. So it's a lot of information, and that's why it's good to have it towards the end of your pregnancy, or like just like when you're like 25, 30 weeks, I would probably take it. And it's just so much to learn and so helpful for new parents, and even 2nd-time parents. There's like a lot of programs that do or organizations that do refreshers.
Mm-hmm.
So you don't have to sit there for like not sit there at one time, but they usually break it up into weekly programs, weekly classes that last just about the whole of your last trimester. So it's a good idea. It's such a great idea.
So shout out to the men that are in the chat who are asking questions.
Oh, great.
What did they ask?
We're gonna answer that, but I just wanted to piggyback off of what you're saying. So for the women who have male partners, and these men want to be coached or they want to understand what's happening with their wives or significant others, what's happening to their bodies and the baby and the different stages. And their interest is like severely piqued because they're about to be a parent. What are the best ways to educate them? Because you're saying childbirth classes 25 to 30 weeks, like later on. What about in the preliminary stages? How do we educate our men?
That's me again.
Yeah.
So again, I love when the men are there. Getting the guys to be on board with their partners and getting them excited about the birth and labor and postpartum is just as important as getting the pregnant person involved. So like for me as a doula, usually we meet a couple of times, and my goal is to have the partner there at least once or twice, just to see how he plays a role in labor, like how he will support the mom, how he will support her at home, what that looks like, what he thinks support looks like for her, and making sure I facilitate a conversation between them to know what's going to happen. And for childbirth education, definitely he needs to be there, and he should be there. He should be knowing what's going on, because and I know people get confused as like, oh, if I have a partner there, do I need a doula? Because I teach the men how to have their girls back, like to truly know that during labor that women are so vulnerable during that time. And yes, we are strong. Yes, we are amazing. Yes, we are bringing life, but labor, it's just like you're just letting your body do what it does, and you need that support. You need people to hold you up. So I really teach the partner how he can show up for his partner during that time. So I definitely think that men should be there. You should definitely have not necessarily a say, but you should back up whatever your girl says, whatever she wants, and it becomes a partnership between he and I on how we're going to best support her.
Got it.
And the baby.
Okay.
So I'm going to ask, we'll answer a question in the chat from Vladimir. The question reads, with COVID restricting office visits and OBs using video, how can a mom make sure her voice is heard through the screen? And if she doesn't agree, how can she maneuver through doctors to find the right one? And I think we kind of answered that, but just in case, because it's sort of a different context because we're adding in COVID restrictions and, being virtual doctor's appointments.
Right. So, with the COVID restrictions, a lot of providers are not allowing family members to be there during the visits. And in this situation with a virtual visit, you still have your list of questions, to ask the provider and make sure, if they're not answering the question, or if the answer, or if they're brushing it off or kind of just like generalizing it or making it seem like, there's some doctors who are like, oh, I've been doing this for how many years? I delivered these many babies. Like, I got this. Like, don't worry about it. You don't need to be concerned. No, I do need to be concerned. So have your questions. Make sure you are heard. And if the provider is not answering the questions or trying to brush you off, then, take the next steps to, to see if there's another, if you like the hospital or you like that clinic, see if there's another doctor there that you can see. Or ask around, ask your friends and family for referrals, or call up, the hospital, or call up the facility, ask, to get the names of providers. You can go to the American Association of Obstetrics and you put in your zip code, and you can get the list of providers in your area and your zip code as well. And these are different different ways you can go about finding a different provider, and then you call and you make an appointment. If it's virtual, you can still have your interview over virtual appointment. Like we do virtual interviews now, that you can still ask your questions and make sure that they answer it appropriately.
And one of the men in the chat, he mentioned something. He said husbands don't undervalue your support because your presence matters. And I think that's important because, it all goes back to having the right support team and support system in place, especially when, like how Thamar mentioned, women are extremely vulnerable during pregnancy and during delivery. And so having the right people, the people that familiar faces, people that you love, and that you trust is very important.
Yes.
And allowing our men from the beginning to be comfortable enough to understand the process and ask questions. So I think that's, that ties into this whole conversation.
Mm-hmm.
I think I'm sorry, but I think it's a really good time to plug in midwives. Midwives can deliver your baby. Midwives, some people get confused about what they're supposed to do and what they do. Midwives are trained professionals that can catch your baby. When it comes to no, they can't do C-sections. They're not doctors, but they can give birth to your baby. And I say that in response to your question, because midwives are taught differently from doctors. They come from learning patient-centered care.
Right.
So the patient comes first. Their patient is not like their last patient. Their next patient is not like their current patient. Like, you are their patient. And of course, there are bad midwives and great doctors, and there are bad doctors and good midwives. Like there's always a mix. But what you could always find with the midwife is they're trained to put you first. So they're trained to answer all your questions. They were just taught that way. Mm-hmm. So if you are looking for a different provider, don't rule out seeing a midwife. There are midwives in hospitals. So usually they're working under doctors' practices. So you just have to look for a practice that has midwives with it. There are midwives that work alone, not alone, but they have their own Park Slope midwives.
Yeah.
They're midwifery groups.
Yeah.
But you have Central Park midwives. And then you have your home birth midwives. So if you are thinking of having birth at home, midwives go to your house and you give birth at home. And I love
so wait, so let's talk about that a little bit, because that's exactly where I was going to tie midwives into. So thank you. So home birth, some people live by them and some people scream stay away. And it's such a touchy topic when discussing that. And I've discussed it with my sister circle, and they're just like, don't you dare talk about home births. And I'm like, why? Let's just have the conversation. Nobody wants to have the conversation. What is the problem?
Right.
So I don't know.
what are some key factors to know about home births, and why are people so turned off when discussing the option?
Okay, so modern society turns us off.
Right.
Modern society turns us off because the white man, I sound like the angry Black woman, the white man took that option away from us. When we look at our African American history, and we look at granny midwives, Black older women were going around to every home catching babies in their communities.
Listen, everywhere. That was the thing.
And white people, exactly, and white people kind of took that away from us.
Right. I mean, births were traditionally in the home. Like
Yes.
even doctors used to go to the home to deliver the babies.
Yeah.
Exactly.
It wasn't
Exactly.
until later on that they started having the births in hospitals, and they could get anesthesia and and not have to deal with that. But yeah,
It was in the home.
In the home.
Exactly. And doctors don't really do that, right? But it is midwives. And I think people, if you're healthy, you can essentially give birth at home. What people don't realize is that you're not sick.
Right.
I think society and media puts it out there like you're pregnant, something could go wrong. A lot of times it really doesn't. And what people don't understand either is that midwives, again, are trained clinical professionals. They are so trained that they can tell something might happen way before you can see it, way before you can feel, sense it, and they will transfer you to the hospital. It's really that easy. It's not that hard. It's really not that hard at all. I love home births. I think that we should be doing them more often. And that's not the only option. You also have the birthing centers. There aren't a lot in New York. They've been closing left and right because it's not profitable. And that's another healthcare system issue.
Some insurances don't cover it. Even midwives as well. Some insurances, you have to make sure they cover.
Exactly. So that's where a lot of the pushback comes, because insurances just aren't paying out for these things that it's because they can't charge for it, because it's really not that expensive.
Right.
You give birth at home. What are you paying for? I mean, well, no, you're paying a lot, but you're not, like, hospitals are making, like someone said in the chat, like C-sections cost more, so like you're paying $30,000-$40,000 for that stuff. And that's not what's happening at home. But I was talking about the birthing center. So like a birthing center is set up like your bedroom. It's ran by midwives. You can give birth at a birthing center, and then you could go home within a few hours if everything is okay. And it's the same thing. So like if there is a problem where you might need more heightened medical attention or more medical equipment that's not offered at a birthing center or in your home, you can go to the hospital, and they'll transfer you to the hospital. So like some resources for that, if you were to be looking for a home birth, to having a home birth, you could go to New York Home Births of New York. Midwives. Yeah. So like just look up Home Birth Midwives of New York. If you want to do the birthing center, there's the Brooklyn Birthing Center. They have the Brooklyn Birthing Center here in Brooklyn, and they just opened one in the city, and the Bronx will be getting one, God willing. The Birthing Place, if you would like to donate, you can go on their Instagram, the Birthing Place BX. That's my spiel. Sorry. Go ahead, Nerline.
I also just wanted to add, I mean, with choosing either a midwife or OBGYN, midwives, they traditionally take care of women who are pregnant women who are low risk. So if you're good and you have you're not high risk and you don't have any history of complications, you can have a midwife see you. And if you do develop any type of high risk, then the midwife can refer you to an OBGYN because OBGYNs can take care of women who are low risk and high risk. And it also plays into choosing and having a home birth or being in the hospital. Some women are more comfortable and they want that natural experience of being in the familiar surroundings, surrounded with their family, because in home births they don't limit the number of people that could be in the room. You could have your kids there, you could have your family there, have a whole barbecue ready for you afterwards, and you can. And after you give birth to your baby, then you can be in your own bed with the baby after that. And you don't have to go to a hospital, afterwards. And other people would love to be in a hospital where they know that everything that they would need in case of an emergency is right then and there. Because there's also the risk of, if there's a complication during the home birth, then you have to be transported to a hospital to deal with an emergency situation. There some risk there, because you would have to it would be delayed because you have to get to the hospital for any treatment. But I mean, I'm considering home birth for the next one. Okay. Tama, I'm gonna reach out to you. I have friends, who are doulas. One of them is actually, I see she made a comment in the chat. So I'm looking towards that route. But it's a personal choice, and getting all the information. But
So,
your preference.
question, Nerline. So once you get, let's say if you're having a home birth and there's an emergency, do you need to be screened when you get to the hospital, or is it just like a rush situation?
What do you mean screened? As for
So when they come in, they're asking questions. Did this, that, and then they put you into like a room and all that, or is it just like we're asking you the questions while we're pushing you through so we can rush this whole thing?
So there is because they don't have your history, because they don't know you, there is some kind of like, okay, well, they're kind of treating you different from patients who are, who've been there and who they know their history, because they don't know anything about you. So they are paying attention and they're asking you these information. But of course, in an emergency situation, they're trying to do that all while trying to figure out and gauge what is going on. But usually your midwife is there with you, your doula, they're there with you, your team is there with you. Then they can have that, professional conversation and passing off and giving the report and letting them know what's going on. But they would also, call ahead the ambulance that's transporting you. They would have that information too to give off to the hospital.
Just to let you know how it works with the birthing center and with home birth midwives, with the birthing center and home birth midwives, they have relationships. They're not sending you to any hospital. Mm-hmm. They have relationships with, let's say you're giving birth in Brooklyn. The Brooklyn Birthing Center has a relationship. They'll send you anywhere you want, but they have a relationship with like Maimonides Hospital. So they'll call up the labor and delivery and say, hey, I'm bringing so-and-so to the hospital right now. This is A, B, and C, and this is what's happening. I'm printing out the stuff. I'm faxing it to you now. I've been the one to fax all that information really fast. The home birth midwives, same thing. They have relationships with different hospitals, and they're privy to calling. And it's not they don't have privileges at the hospital, but they have relationships with the hospitals, and they know, and they know that they're coming or things like that. Or sometimes some midwives even have relationships with particular doctors so that they can get in quicker. I'm not getting quicker, but like just get in and have someone that knows what's going on with the patient. So there are relationships there. Midwives aren't just like rogue and working on their own and things like that. They build relationships. So they have those things. They've trained in those hospitals a lot of time. So it's not like carte blanche to them. Like they have relationships.
And Tracy dropped in the chat and said she's a midwife baby because her mother had a C-section before her. But then, and they told her she couldn't have a VBAC, and she said, okay, so she found a midwife, and here she is, X amount of years later. So that's a beautiful story and a testament to, having this midwife conversation. Because a lot of people often told me, stay away from midwives, right? And I'm like, why? Like, why? My mother's a midwife baby. And they're like, go to doctors, they know everything. But honestly, sometimes that's not the truth, but different conversations.
Tracy asked another question that I want to answer. She said, what are some techniques, if there's any, to ensure a VBAC? So if you're talking to me before you had like that first baby, you want to make sure that the C-section is done right. You want to make sure that the C-section, like you said earlier, Nerline, the transverse stitching, it has to be like a double suture, and just making sure they put everything in the right place.
Put everything back.
And you want to make sure that
you found it.
Yeah, put it back where you found it. Put it back real slow, real nice. Residents, don't touch me. Okay? Don't touch me.
I put that in
I
my
am
birth.
a Black woman. Do not touch me.
Yeah.
Okay. We got that?
Say one more time.
I am a Black woman. Do not touch me. Period.
That's for the people in the back.
Okay? And you want to make sure you have your medical records, because the next doctor that you go to, or a midwife, and yeah, they do VBACs. You didn't hear that from me because they won't ever say it, but they do. Okay. you want to make sure that you have that thing, because they do have to see how it was done. They just want to make sure that everything was correct, why you got the C-section, just so that they're aware. They want to make sure that a big thing that I realize is that they want to make sure that you felt labor, like you went through labor for a couple of contractions, like you had a couple of contractions, you were kind of dilated. They want to make sure all those things happen the first time. I'm not sure clinically why, but that's a question I know that they ask. So yeah, that's it.
So,
and Farrah,
go ahead.
No, go ahead.
So I didn't want to skip some questions that were in the chat. So Elisha Pierre asked, how important is a birthing plan and going over the birthing plan with your significant other, doula, and other health professionals, which we covered, but can you give in like maybe a 30-second recap, because he may have missed that part. So maybe Nerline or Thamar, it doesn't matter.
Well, the birthing plan is, is very important to have that conversation with your provider about what your wishes are, and you guys can work together. Because, like for me, my first experience, I had my birthing plan and and I came in like, okay, this is what I want. This is, and I had the whole list. And my doctor, she was like, okay, let's sit down and let's talk about it. Let's discuss this together and let's work it out. Because, you have to respect them as providers as well, that, there might be some things they may not be comfortable with. And so, that's why it's very important to have that conversation and to know, what your doctor's, limits are. Like, at what point would they, say, okay, well, now I would move on. I would recommend to have a C-section. Maybe some doctors don't want you to labor for hours and hours and hours, and their theory or their practices, this is what they're used to doing. So, it's very important to have that conversation. And if there's some things that you're just like, I'm not changing my mind about, I mean, if that's not the right fit, then, you move on and you go and interview and meet with someone else to see if you can find that match. But your birthing plan is very important. Don't let anyone tell you that, it's not important. And that you're just going to follow whatever, that provider wants to do. If you want to have a ball in the room while you're laboring, if you want to have a mirror in the room as well, like you can put these things, in there. If you don't want residents touching you, you can put that in your birthing plan as well.
Yes, back to the residents. Now,
keep in mind, if you go to a teaching hospital, they're going to have, residents there, but, if that's in your birth plan and your doctor's aware, they will make sure to speak with the staff, and they may talk to say, we'll limit the contact or, the visits of the residents as well.
So there's just one more question in the chat that I want to ask. So this conversation is an hour and a half long. I have so much more questions for you guys. And so this question ties into where I want to go into. And it was asked by Farrah, can you ladies please host a part 2 of this conversation before the month is over and include reproductive health, fertility, and all those related topics? And what I was going to say is that there just wasn't enough time, like we said, from, days before this, the topics and the conversation is a lot. Because when you're talking about navigating pregnancy, Black maternal health, understanding your level of care, treatments, providers, and all that, it's not a conversation that you can have in 30 minutes. It's not a conversation you can have in an hour, because there's so much to discuss and there's bits and pieces for everyone. And so breaking it down to make it make sense for you, there's people in the chat or who's listening, who's watching the live stream, you're pulling pieces saying, oh, that's for me, that's not for me. And that's what this conversation is about. It's educational. It's supposed to be awareness. And you're talking to advocates, Nerline and Thamar, who are advocates for women's health. And it's important that we continue this conversation and give the people what they need. They need a part 2. And so,
can I say one thing?
Yeah, go ahead.
Are we finishing up?
No, we have one more thing that I just want to talk about before we do.
Okay, hopefully this is not it, but I don't want to forget. And because this is called navigating pregnancy during a pandemic, um, women are alone during this time. So I think I was at an event a couple of weeks ago, and I was telling the people that please, for postpartum women, you need to reach out to them. If you are someone that's single or you don't have kids and you don't, plan on having kids anytime soon, understanding the plight of a mother right now is really crucial to her well-being. So if you could help out with, ordering food and sending it to her house, sending cleaning services, like whatever you could do, or calling her and asking her and just talking to her for 20 minutes on FaceTime, or like the phone is on speaker, like, and she's doing a million things, just like talk to her. Because, I have this one client right now. I'm supposed to be helping her with breastfeeding virtually, but we don't even, at this point, I think we spoke today for like 30 minutes and there was no breastfeeding to be had. But she has 10-year-old twins and a newborn. Her husband is working double shifts and her kids are home because they're learning remotely, and she's trying to breastfeed and she's trying to feed. And at the beginning of quarantine, she was taking care of her father that had COVID, and she ended up having COVID. So she has this scare of like people coming over to give her kids a COVID diagnosis. And it's like, we just need to be more intentional about reaching out to new moms and helping them, because there's the layer of being a new mom and dealing with postpartum depression and dealing with just postpartum things, and then adding that layer of a pandemic on there. So just please be mindful. That was my soapbox.
So this is not, this is just a part of it. I did want to touch on postpartum and support services, but let's talk about how long postpartum lasts, because people think after 1 or 2 months, that's it. So let's talk about that. What can you expect? How long does it last? And what are some things that women can use to help them navigate during this time?
Yeah, it's definitely not just 2 months. Every woman is different, but postpartum could last up to a couple of years after you've given birth. But it providing that support, and like Thamar said, check in on them if you can. Get groceries. Having that support, especially for brand new moms, it's a lot. There's a lot that's been going on. Your body's changing. Hormones are not, back to what they were. And if you're breastfeeding, you want to give your baby your breast. I've had a lot of patients and friends who, had difficulty with breastfeeding, and you feel inadequate. You feel like, I can't, give my body is not feeding my baby. It's a lot. And, I always tell them, keep going, keep pushing, keep at it, keep trying. And it's okay if you have to give your baby formula, or if you do a mixture of the two. But just supporting and encouraging the mothers, to let them know that they have support. They have someone in their corner. A phone call, checking in on them. If we were not in the pandemic, maybe babysitting or taking the older children, or being there. Like, I was very fortunate to have that support of my mother and my mother-in-law that would come, and while I'm sleeping, they're feeding the baby, or they're cooking, making food so I can eat, so that I can produce the milk to feed my baby. So, reach out to them, if you're, they may not be verbalizing it. They may not be saying anything. You may not see them posting these things on social media, but do that, reach out, or just be proactive. Don't wait for them to ask you, but be proactive and anticipate that, these are the things that they may need, especially, what you would like someone to do for you, be intentional in that way.
Yeah.
So we have to understand or realize the signs and the symptoms in others, but as a woman, you should know, because I feel like sometimes people don't know that like they're having postpartum symptoms, and they're going through that phase. I've had a really close friend of mine who didn't realize, and it was not until one day I went to her house and she broke down, and I realized that I had to help out.
Right.
And she didn't really believe in going to get help, professional help, but there is support in community. There's support in family. And so we didn't realize that she was having these issues just because we spoke to her and everything looked fine. So is there anything that we can look out for, in our circles to see if anyone is actually going through this stage?
I mean, I think the first step is to always make yourself available to your friends that just given birth. A lot of times, I mean, to be honest, I would just get them to go to a professional. I mean, I know I'm a doula and I should be able to tell, but there's the postpartum blues where they do go through, like every woman has this moment, especially right in the beginning because of your hormones and like the breast milk coming in.
Yeah.
Like you literally go through like postpartum depression in a day almost. Like, so that is normal. But it becomes not being normal when it's a couple of weeks and you're still not feeling yourself, or you're not feeling like you want to interact with your baby or engage with your baby, or you don't feel like, some women, I have heard some women say like they don't feel that instant connection with their baby or things like that, and that's normal also. But I think that if you see something and it's not clear to you or you're not okay with it, you would ask your friend or your friend's partner to refer her to a therapist or back to their provider, and their provider will assist them further, because it's they need to talk to somebody to really, really be able to tell. And what people don't usually talk about is during pregnancy, you actually have anxiety disorders and depression during pregnancy. I don't often talk about this, but I'm beginning to talk more about it, but I did deal with pregnancy, like anxiety during my pregnancy, and not so much after. So that is a thing too. So if you do feel like there are signs during your pregnancy, you should talk to somebody too. Throughout that time too.
Yeah. That's really good and really important.
And like you talked about postpartum, I think I'm still in postpartum. Okay. My son is 10. I don't care. I'm still in postpartum. Like, when does it end? Come on. I don't know. Who knows? Who cares?
But that's exactly why they should see their provider. If they're having, these feelings or these symptoms, like we're saying, like not feeling engaging, or or even if the partner, if you notice maybe something's off, maybe this is how they're talking, it's just like, maybe something's not right. Encourage them to speak to a professional, definitely. Maybe Tama, maybe did you speak to a professional?
No, I was good. After I gave birth.
You think you still?
She's like 10 years later.
10 years later, I'm still considered postpartum. No, we don't know. There's no real cutoff. For some,
Listen, there's no more rules.
This first year that you're in your postpartum period. Who knows?
Yeah.
Who knows how long it lasts?
Guess what, ladies? There's no more rules. After 2020.
2020 broke all the rules, ladies.
I get it. Yeah. Whatever you want, and no judgment zone.
Exactly. I'm not judging anything. But also about postpartum, you don't have there's a big thing around waiting 6 weeks to see your doctor. No. Or like during a C-section, waiting 4 weeks. Call them if you want to see them before something is wrong, especially when it comes to preeclampsia. You're having those signs of headaches, high blood pressure, and things like that. Call your doctor. Call your doctor when you get home. Midwife, I know at the birthing center and home birth midwives, they come if everything is like copacetic. They come see you at home. Birthing center also, they go see. Well, I don't know during COVID, but they do go see you at home within 3 days of giving birth, and that's a vital.
No, that's true. I've had women that after they were discharged home, that had to come back in, because, they were still bleeding, that, that lochia is supposed to be, over time get like kind of like ending and get less and less, but no, they were, the clots were bigger or they were bleeding more profusely and they had to come in, and there, something was wrong. They may have had an infection, or the C-section incision, got infected, or they were hemorrhaging from there as well. So it's, those symptoms, if you notice something's not right, definitely call your doctor to let them know so that you could be checked out.
So we have a few more minutes before we end. So I just want to talk about, and again, we didn't even get to talk about holistic and support services, but we can do that in part 2. But I just want to talk about prenatal massages before we end, since that's like a really light topic. Mm-hmm. Is that something that you both may recommend, or is it something you say stay away from? It's not for everyone. So just give me your feedback and thoughts on that, because I hear a lot of different views on prenatal massages, but there are people who live by it.
I mean, I don't have, I will leave the default to you, Thamar. Maybe you know more about it. I don't have that much experience with, prenatal massage. I have had patients who have gotten it, but towards, later on in their pregnancy. So they swear by it. It was great, and it helped them to calm them down, make lessen the stress and the anxiety. So I'm not against it. I would love to try it out myself. But Thamar, I don't know if you have anything else that you would add on if you know more about it.
I mean, you just want to make sure you go to a trained professional that knows how to do prenatal massages. There's one person that I love, and her name is not coming to me, and she's in the city. Her name's not coming to me, but I will give that information to Hack. But you want to go to someone that is trained and they know, because and to me that goes back into like Chinese medicine and things like that, because different parts of your body could throw you into labor. So that's why they're big on not necessarily doing it in the beginning, mm-hmm. and just like letting your body do what it does. But a lot of people I know do massages often, and that's okay, because listen, you know what labor, I mean, I know what being pregnant feels like, and a massage would have been real nice. Yeah. So, why not? But like what you were saying with the different type of services, like going to see an acupuncturist, that is totally normal, but not necessarily totally normal at the beginning of your pregnancy, because again, the whole throwing you into labor. And people actually go to acupuncturists because they can't go into labor, and their midwife would kind of refer them to go see an acupuncturist to see if they could get labor going.
Mm-hmm. Yeah.
So, or a chiropractor.
I was put onto that recently, and I'm looking into that. That sounds good.
Yeah. Or a chiropractor too. Sometimes, especially with Black women, so like physiologically, our bodies are different. Mm-hmm. Our pelvises are like more narrow than white women historically. So like, sometimes seeing the chiropractor to kind of realign your back or something like that. I literally had a patient where she was having contractions and they were sporadic and things like that. And we took her to the chiropractor. He tickled me. I don't know what happened, but as soon as that happened, a couple of hours that night, she went into full blown real labor contractions, real tough. And she was able to give birth a couple of hours after that. So there's options. Castor oil, I heard.
Castor oil. Oh, yeah.
Yeah, castor oil, I heard is a.
I heard. Well, but thinking with castor oil, people also take castor oil as a laxative, right? Yes. What happens when you take it as a laxative? It triggers your your colon, your intestines to contract so that it moves the stool along. So it kind of mimics contractions as well, and that's what leads to labor. You're pooping on yourself, but hey.
Listen, I just want to tell you guys another reason why I did not want to discuss pregnancy ever. I think maybe I was 19 years old or 20 years old, and I saw one of my best friends giving birth. There was poop everywhere. There was stuff everywhere. So I was like, oh no, not me.
That's another reason why some women, that's another thing with home birth. You can eat what you want, right? Because when you're in the hospital, they restrict you from not eating when you're in labor, just in case you have to go to C-section. They don't want you to aspirate, right? But that was one of my fears too when I went to labor, and I won't share my story, but yeah, it's not the greatest. It's
not
because I won't share my story.
Those muscles are trying to push everything down. You just lose.
I didn't poop during labor, just so you know. But Louis Muscatine castor oil, it is.
Yeah.
But that you should definitely have a conversation with your healthcare professional when it comes to taking thing, because what people don't realize is it's gonna throw you into labor, but it's also gonna send you to the bathroom, which also means you have to be hella hydrated. Because dehydration and labor, they don't go together. So you have to make sure that you're hydrated if you're gonna do something like that. Castor oil, I took it, but you didn't hear me say that.
We're not gonna discuss that right now.
It was a good, like, y'all know my birth story. Like, I have a pretty good, positive, I should say, birth story. But the castor oil thing is not something I would do just on my own. I would. Some doctors don't really do that. They don't want to hear about it. Some midwives don't want to. Some do. Some recommend it if, like, you're not going into labor and it's like you're 40 weeks and 5 days pregnant and you're still not going into labor. They'll probably tell you, but that's not the only thing that'll throw you into labor.
Got it.
Naturally.
Yeah.
Got it. Oh my gosh, ladies, it's been 2 hours.
I know.
This
was 3 hours.
Thing.
It went really fast.
Yeah. It went really fast. We still have a lot more to discuss. So we definitely will do a part 2. Thank you to everyone who participated. Remember that HAC is looking for more people to join the organization. So if you go to the website before midnight, hackglobal.org/join, and you sign up to be a member, you will automatically be entered into getting a free Lyft code and a free DoorDash code, which gives you a full and free meal delivery right to your door, so you don't have to go out. And you can use the Lyft code to go to your next appointment, to see a provider, to run to the grocery store, whatever you need it for, you can use that. So remember, if you go to hackglobal.org/join and sign up before 11:59 p.m. tonight, 11/11/2020, that you will automatically be entered to get these free codes. Again, thank you to our sponsors, Lyft and DoorDash, for allowing us to have this conversation tonight. We will be doing a part 2 because there's a lot that we need to discuss. We also had amazing people in the chat that asked questions, and another provider who we will be reaching out to, who was speaking about prenatal care virtually, and some other good topics that we can add on to the part 2 conversation. So again, thank you so much, Thamar and Nerline, for really being experts in this conversation and allowing our Black and Brown women to join this conversation and be comfortable and vulnerable enough to ask the most important questions that defines their next steps as they are pregnancy planning or as they currently are expecting their next child. So thank you so much. Again, do you have anything to share before we end? I do want to say, if we can throw this up on the screen, please go ahead and follow Thamar. And what is your Instagram name again? Is it?
It's at Thamar Innocent. It's my name, THAMAR Innocent. And sign up to, when you get to my page, sign up to be a part of my email list, because hopefully with the new year, I'll be releasing like a pregnancy planning course. So preparing your body for pregnancy. So be on the lookout for that.
Awesome. And Nerline, please share your Instagram page.
My Instagram, sure. My Instagram is at Life by Neural. And you can come and follow me, and I will be posting and sharing content on women's health, maternity, midwifery, different things that you need to do health wise, and sharing my personal journey and on health advice, cooking videos, just a whole bunch of different things to share.
Oh, I can't wait. Okay. And again, my name was Debbie Lewis. I was the moderator for tonight. You can follow me on Instagram at thedebbielewis.com. If you do have any additional questions, you can also find me on Facebook under Debbie Lewis Caesar. You can drop your questions. We can incorporate it for our part 2. And again, thank you. This was an exciting night. Everyone be well and be safe.
All right. Thank you.
Have a good night.
Bye.